Have you ever wondered if different health conditions might share the same early warning signs, making them tricky to tell apart? It turns out that is often the case, especially when it comes to cancers that affect very similar parts of your body. Understanding these nuances can make a big difference in how you approach your health. When it comes to early colon and rectal cancer, their symptoms are often remarkably similar. Because the colon and rectum are part of one continuous structure, the large intestine, many of the initial signs of cancer in these areas overlap. These common symptoms can include changes in bowel habits like diarrhea or constipation, a feeling that your bowel does not empty completely, blood in your stool, narrow stools, abdominal discomfort such as cramps, gas, or pain, and unexplained weight loss or fatigue. The reason for this similarity lies in the shared anatomy and function of the colon and rectum. Both are responsible for absorbing water and forming stool. A tumor developing anywhere along this pathway can cause irritation, bleeding, or partial obstruction. Symptoms typically arise from how the tumor interferes with normal digestion and elimination. Whether a tumor is in the upper part of the colon or closer to the rectum, the body's response, such as altered bowel movements or bleeding, can present in much the same way. Since distinguishing between these two conditions based solely on early symptoms is challenging for individuals, the crucial step is to pay attention to any persistent changes and consult a healthcare professional. They will ask specific questions about your symptoms, medical history, and family history. Diagnostic tools like a colonoscopy are essential, as they allow a doctor to visually examine the entire large intestine, from the colon to the rectum, identify the exact location of any abnormalities, and take biopsies for accurate diagnosis. An important point to remember is that while the early symptoms often mirror each other, the diagnostic journey focuses on identifying the tumor's precise location. For instance, sometimes a doctor might use the umbrella term colorectal cancer to describe both, acknowledging their shared origin and symptomatic presentation. However, knowing the specific location, whether it is colon or rectal, is vital for determining the most effective and targeted treatment plan, which can sometimes differ significantly due to the rectum's unique anatomical position within the pelvis. Ultimately, the most important takeaway is not to try and self-diagnose whether a symptom points to colon versus rectal cancer. Instead, empower yourself by recognizing these potential early warning signs, understanding that they are shared, and promptly discussing any concerning changes with your doctor. Early detection and accurate diagnosis through proper medical evaluation are your best allies for managing either condition effectively.